I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by Dr. Nesbitt to provide an update on the district's response to COVID-19. We're also joined by Chancellor Louis Farabee, who will provide a DCPS budget process update, and Director Chris Rodriguez, who will be available for questions about the district's response and the weather we're experiencing in the district. Let me put up a number to remind people that we are experiencing a very bitter cold snap. If people are exposed to these conditions, especially when it's wet and cold, they will not survive. And unfortunately, we have experienced death related to this cold snap from at least one resident experiencing homelessness. So please call us. We will do our very best to get people to come inside. And you can call us at 202-399-7093. And once again, we will do everything possible to have someone come in from the cold in these conditions. And we do have safe shelter available for them. So please help us. We also want to provide some information about emergency utility contacts. We, given our weather forecast and conditions, are not anticipating any major utility issues, but we know that everyone is watching what's happening to our fellow Americans in Texas with great heartache, and we want you to have all of the information that you can should we experience any weather-related issues. Though again, we don't anticipate those. The emergency utility contacts for Washington Gas, DC Water, and Pepco are listed. It's always a good idea to keep this contact information available. And I wanted Chris just to take one moment to talk about how our electric grid is different. And Chris, it may be a good idea as well from an emergency management point of view to talk about what people should have in their homes in case of emergency.
Thank you, Mayor Bowser. And again, to echo the mayor's comments, certainly our hearts go out to Texas and the fellow Americans there who are experiencing what one of my colleagues in Texas referred to as one of the worst humanitarian disasters that he is experiencing down there in that state. One of the challenges that I think that state is facing, and this has been reported, so not something that might be new to many of you, but and that contrasts a lot with what we do here in Washington, D.C., and indeed throughout the East Coast of the United States, is provide a redundancy in our electrical grid. We draw power from a variety of different sources, whereas if one part of a system goes down, another part is able to very quickly replenish or restore power to our electrical grid. And there are certainly, as the mayor mentioned, resources online. You can go to Pepco and DC Water and see a lot of the infrastructure projects that they are engaged in over the next several years to build even further redundancy into our power grid. To contrast with what we are seeing in Texas is that there is not a lot of redundancy in their power. There's a lot of, for example, they rely a lot on almost one source of energy, which is natural gas. And as we've seen in the press, a lot of their natural gas resources are not able to be started or restarted because of the winter and the harsh weather that they're seeing down there. A lot of their facilities have not been winterized as they are here on the East Coast. And so I think over time there's a lot of opportunity for them to, again, relook at their infrastructure. And certainly that will be ongoing. For our residents here in the district and certainly in the region, it is important to continue to watch the weather, to tune in, obviously, to these press conferences about what the district is doing to prepare for harsh winter weather. We have seen over the last 10 days on and off wintry mixes of snow and freezing rain. And to make sure you're staying off the roads if you don't need to be out, particularly with some of the conditions we're seeing out there. Make sure you have adequate supplies of water. If you, typically what you should do is before you go to bed at night and you're expecting some harsh weather, charge your cell phones, charge your devices so you can maintain communications with your loved ones, your family, and your friends. And so I think that's really the best way for our residents to build resiliency into their response to some of this harsh weather that we're seeing. Thank you, Mayor.
Thank you, Chris. And let me just say that Dr. Nesbitt will have a detailed update for us about vaccinations, but I want to just remark, as we announced last evening, that today there will be additional sets of groups available for vaccinations. For starting today at 6 p.m., individuals who work in grocery store settings, health and human services and social services outreach workers, individuals who work in manufacturing or food packaging will be added to the list of eligible workers and DC residents. So that full list is in front of us now. Individuals who work in healthcare settings, members of DC Fire and Emergency Medical Services, residents of long-term care facilities, residents who are 65 or older, individuals experiencing homelessness, MPD, DC teachers who work for DC public schools, DC public charter schools, private schools in DC, and child care providers. Department of Corrections employees and residents at DC jail, continuity of government personnel, government operations personnel, as I mentioned, new today, grocery workers, health and human services workers, individuals in manufacturing or food packaging. So know that you can go to the portal, Vaccinate.dc.gov, beginning today for priority zip codes, and those zip codes are 20422, 20011, 20017, 20018, 20002, 20001, 20019, 20020, 20032, and 20593. And you can go to the portal at 6 p.m. You may also call 855-363-0333. And tomorrow, Friday, also beginning at 6 p.m., you may, all zip codes are eligible for DC residents and DC workers. So again, vaccinatedc.gov or call 855-363-0333 if you cannot connect online. We also announced that we will have an alternating morning and evening schedule for sign-ups. So this week, obviously, there's an evening sign-up at 6 p.m. Next week, on Thursday and Friday, it will be morning sign-ups at 9 a.m., and it will alternate from there. So let me also just mention, as we have before, that in addition to the portal, DC Health has set up several vaccination clinics for special initiatives. We know that DCPS and DC Health work together for a special clinic for DC teachers and staff. And when I say that, I don't think we emphasize enough that teachers have had priority vaccinations, but so too have the administrators, the custodial staff, the food workers, all people who support in-person learning. Additionally, the charter schools, child care providers, and independent school staff have also had a clinic supported by One Medical. Our staff at MPD, DOC, fire and emergency medical have also been supported by the Kaiser Vaccination Clinic. Johns Hopkins is doing a special initiative for us for senior housing properties, and Unity is working with our homeless population and also the Department of Corrections. Our DDS residents and DBH residents who are in the intermediate or other community facilities have been supported by independent pharmacies in the district who have been great partners, as I understand from Dr. Nesbitt, and Giant Food. Senior vaccine buddies are being supported by the Safeway clinics, and the faith-based pilot initiative is being supported by Mary's Center and 5 Medicine. So there are a number of initiatives there to get vaccine out as soon as possible. The next population that will become eligible for the vaccine will be DC residents who are 16 to 64 with qualifying medical conditions. On March 1st, therefore, we will begin Phase 1C, Tier 1, and the medical conditions for the qualifying medical conditions for people who are the ages 16 to 64. And at that point, I'm going to turn to Dr. Nesbitt to say more.
Sure. Thank you, Madam Mayor. And you all will note that the list of qualifying medical conditions is before you. We had previously, in identifying this tier, Phase 1C, Tier 1, had discussions with you all and with the public in terms of how this tier may be informed based on what we were experiencing in terms of vaccine demand and vaccine supply, and any additional information as our process has been throughout in terms of being informed by science and letting that drive our process. So as the Phase 1C Tier 1 was outlined, that we would be looking to provide access to vaccination for individuals who were identified to have a higher risk of severe complications from COVID-19. We did a literature review as well as reviewing the CDC's Advisory Committee for Immunization Practices recommendations, and met with our Scientific Advisory Committee, I believe it was a week and a half ago at this point, for their guidance and feedback on the medical conditions that should be considered in the context of vaccine supply and the population size of this group. To be able to continue to move forward with creating vaccine access for the populations who have had a disproportionate burden of disease in the district, as well as those who would be at higher risk for complications. As such, the qualifying medical conditions are provided here. Individuals will self-attest when they register for an appointment on the Vaccinate.dc.gov site, or when being vaccinated by their healthcare provider if their healthcare provider is a COVID-19 vaccine provider in the district. So there is no need for a person who registers for an appointment through the portal to have any documentation from their healthcare provider. This is a self-attestation. So if a health condition is not included here, it would not be considered a qualifying medical condition. So I know we continue to receive questions about that. This is the list of qualifying medical conditions. Be happy to provide clarification during our question and answering. At this time, I'd also like to be able to move into a discussion about where we are in the district as it relates to COVID-19 trends and our current phase. In the District of Columbia, as of today, and we provide this data every day, and it's on our coronavirus.dc.gov website. In our tab, we provide the detailed information around our level of community spread, health system capacity, public health system capacity, and community engagement in the District of Columbia. It is our position that this combination of metrics are the best public-facing metrics that help the public understand where we stand with with the pandemic in the District of Columbia. The District of Columbia is currently in phase 2. We provide additional information related to each one of these metrics to show the trends over time in the District of Columbia, because we believe an analysis of trends help us to be centered around the impact of the pandemic in the District of Columbia. This is what we refer to as an epi curve. And you often see these curves on many of the news channels when they're showing this as it relates to the waves of COVID-19 that have occurred in the country or in any particular jurisdiction. So this is what's called the epi curve for the District of Columbia, showing that early in the spring with the pandemic, we had our first wave of cases. And you'll notice that after the holidays, we had additional large wave with cases being higher than they were in the springtime. The total tally of this is what reflects what has been our experience, unfortunately, with having over 39,000 district residents being diagnosed with COVID-19. And again, these are the individual cases that we know about that have been diagnosed. We know that there are many other cases that occur in our community that are never diagnosed through testing, either because individuals don't know that they have symptoms or because their symptoms are mild and they don't present to testing. We also provide this on a daily basis. It's the trend and the daily case rate. We do average our daily case rate over a 7-day period to be able to allow in the daily fluctuations of reported cases that we present. And we've asked that, for example, if you see 49 cases on one day, 100 cases on the next day, the 7-day average allows for us to account for those fluctuation in our trends. You'll note that while we've been experiencing a downward trend over the past few weeks, we are still in what we call substantial community spread in the District of Columbia. You'll remember that during the holiday season, and we often think of the holiday season as before Halloween, when we ask people to consider their activities, to be thoughtful about the things that they would participate in so that we could reduce the risk of spread. We were in moderate community spread and even had some periods of time in the district where we were experiencing a downward trend that would have gotten us very close to that minimal community spread or containment that we've been aspiring to since the beginning of the pandemic. Because we had a tremendous amount of high-risk activity, things like non-essential travel, gatherings where people maybe didn't social distance or wear their mask all the time, we saw rapid acceleration in our daily case rate during the holiday season. From Halloween to Thanksgiving, saw a small dip between the Thanksgiving cases and the Christmas holiday season, and then another acceleration between Christmas and the beginning of the year. Fortunately, like most of the country, we are now beginning to see another deceleration or downward trend from the beginning of the year that appears to be sustained. However, we are cautiously optimistic given that we do not yet know what the impact of variants that have now become more dominant in the U.S. or have the potential to be more dominant in the U.S. will be. These variants have an increased rate of transmission, meaning the number of individuals who are infected by each positive case is much higher than the strains that have previously been more prominent in the United States. The other metric that we look at that has been positive in the district for quite some time is our test positivity rate. So this is the number of individuals who have a positive COVID-19 PCR test in the District of Columbia based on the overall number of individuals who were tested during that time period. Our goal is to have this number be below 3%. We've managed to keep the number below 10%, which I think is remarkable in the face of us having a high daily case rate. You will note, however, that this number also is linked to the volume of testing that we have or the number of diagnostic tests. Because some people can be positive with COVID-19 and not have symptoms, it's critically important that people continue to be tested if they have a high-risk exposure, if they've been told that they have a contact to a case, if they work in high-risk environments. So we want to make sure that the amount of testing that is available in the district, people still take advantage of it, that you're in touch with your healthcare provider about your access to testing, and that you take advantage of the policies that have been implemented by DC Health and Department of Insurance, Securities, and Banking that ensures ensures that your healthcare insurance covers your testing in DC. So we have the opportunity to really take advantage of these downward trends that we're seeing in cases and a vaccination program for COVID-19 that is picking up pace in DC. Here we post these graphs as well on coronavirus.dc.gov. We vaccinated over 87,000 individuals in the District of Columbia, both workers and DC residents. And though out of that 87,000, nearly 51,000 of them are DC residents. Here's a map of where they live by our health planning neighborhoods, and 7.2% of our population has been partially or fully vaccinated to death. And 2.5% of them have been completely vaccinated, meaning that they have received both doses of the vaccine. This is the breakdown by ward. You can see that the highest percentage of individuals who have received the first dose of the vaccine are residents of Ward 3, and the lowest percentage of individuals who have received the vaccine are residents of Ward 8. In terms of being fully vaccinated, the same phenomena persist, with the highest percentage of individuals in Ward 3 and the lowest percentage of individuals in Ward 8. And we also see that with the individuals over the age of 65. We present this map because it's important to remember that all residents age 65 and older are not equally distributed across the District of Columbia. So this map helps people to be oriented to the percentage of individuals over 65 based on where the number of residents over 65 live. Now, we still have a ways to go in improving the quality of race and ethnicity data. The ethnicity data for residents, as I mentioned, we've vaccinated over 50,000 DC residents. Ethnicity data is missing for over half of those residents. We continue to try to make improvements in the quality of that data in partnership with our providers, as well as using other methods in terms of searching through health records, et cetera, to try to find a documented race and ethnicity for individuals. The data for race has improved, although we still have about 10% of that data being missing, documented as unknown. And the other category still seems to be over-documented or overused. But you can see here how vaccines have been distributed by Black, white, and other. So I'll stop there and be available to answer any questions.
Thank you, Doc. Dr. Farabee?
Thank you, Mayor Bowser. We are proud to begin the distribution of school-based budgets to schools today. Today, schools will receive their initial budgets, and I think it's important as we begin this season to review what the DCPS budget allocation process is like. So it begins with schools receiving their initial budgets that are based on their enrollment for the school year. And then we account for any unique needs for the school related to their student population. And then we formulate our comprehensive staffing model for each school based on their unique circumstances and population. And then schools will receive their initial budgets, which they're receiving today. Once schools receive their initial budgets, they have the opportunity to collaborate with their local school advisory teams to help finalize their staffing plan and also organize any other supports that are anticipated for the 21-22 school year. Once those budgets are finalized at the school level with the local school advisory team, schools also have the ability to petition for additional resources for budget assistance. They also have the ability to petition to make modifications to their staffing plans. Once those petitions and requests are reviewed or approved or denied, then the DCPS school budgets are then folded and combined into the central service budget and then to the mayor's budget that is presented to the council. So that is the DCPS budget review process. Looking ahead as we prepare for the 21-22 school year, we're looking to recover strong and provide services for acceleration during the 21-22 school year, along with the summer, knowing that our students and families have critical needs. We are blending sources of local dollars and federal dollars along with federal stimulus funds to provide the needed resources for the summer and the 21-22 school year. This includes a plethora of foundational resources that we believe are critical to the academic success of our students and also their social emotional well-being. This includes a $15 million investments to stabilize school budgets in a time period where many of our schools are projected to realize a decrease in enrollment. We do know that this is a national issue. We believe it's an anomaly as we look forward to welcoming more students back on our campus, and we also reminded families that we're in enrollment season right now. We also are looking to maintain our cluster support model, which is the primary tool that we utilize to help remove barriers for teaching and learning for schools and support our school principals and school leaders. And often is referred to as a very sound and solid structure that allows schools to receive not only central service supports, but also to proactive troubleshoot any barriers that schools may be realizing. And then finally, we want to maintain our critical supports as a part of our foundation. This includes our home visits and other supports that we've seen be a tremendous boost to student outcomes. We also are providing acceleration funds for schools that we'll talk a little bit more about, and then technology for our students and our teachers. We're also pleased to feature new elements to our budget materials and resources for families and schools. So this school year, we continue to refine elements of transparency and information that individuals can find on the DCPS budget website. We're also using our Pocket Dot again, which can be downloaded, and we also have a mobile-friendly version of the Pocket Guide as well. And then we'll provide initial budget allocation sheets that provide very detailed information on the school's allocation, which includes a narrative that compares a year-over-year analysis of the school's funding for the fiscal year. And then we also are providing, again, more information on the stimulus resources that schools are receiving to accelerate learning and provide social emotional supports. Going forward, a part of our plans for schools is to maximize the acceleration dollars in a number of different ways. First of all, we'll have universal central service supports that will be provided to schools. For example, we'll have our summer programming that will be available to all students. This year, we're adding an element for our pre-K students, and then pre-K through 8 will have their academic and enrichment activities for the summer, and then we'll be continuing to focus on credits for our secondary students as they look towards graduation. In addition to our universal supports available to all of our students, we're asking schools to plan for what we call acceleration academies. These academies will target about 20 to 35% of our student population based on our current assessment data of student mastery of skills. These acceleration academies can occur over the summer, before and after school, Saturdays, anytime schools have to get in additional learning time for students. Our most intensive model is our high-dose tutoring, which is going to be targeted for a very small group of students at each school, approximately 10% of our student population. This will be 1-to-1 or 1-to-3 tutoring that would occur, again, over the summer, before, after school, and time periods where students can get additional time with teachers or tutors. Schools will begin their planning process as soon as they receive their budgets, and we're asking our school leaders to engage with staff and family, community members on not only their budgets for the upcoming school year, but also their academic acceleration plans. And this process resembles what we have been able to accomplish with our reopening community core teams that help drive the reopening plans for all of our schools. And as we did the reopening plans, we'll be providing schools with guidelines and guardrails of how to develop these services for families. Looking ahead, we're also, again, reminding families that we're in enrollment season. We're encouraging all of our families who have not submitted an application for grades pre-K 3 to 8th grade to please do so. The deadline is March 1st, and we want families to submit that application so we can begin the matching process. And again, you can call the My School DC office or go to the My School DC website, which is www.myschooldc.org. Thank you.
And finally, we want to let everyone know that we have 2 budget engagement forums remaining. It's all virtual, and you can dial in and also watch online, watch live, and interact live at budget.dc.gov. You may dial in at 855-925-2801, and there's a code 9046. And you may also watch on Channel 16, Twitter, Facebook, and budget.dc.gov. So we hope that you will tune in today or Saturday. So with that, we'll take questions. Any questions? Yes, Amanda?
Thank you for holding the pressure. When DC opens up eligibility to people with select chronic medical conditions, will DC Health start with residents 50 or older, or should we expect to start with that 16 and older? And are we starting with specific chronic medical conditions, or is it the whole list?
So thanks for asking the clarifying question, but as it is written and as it should be interpreted, it is for individuals 16 to 64, and it is for all of the qualifying medical conditions as written. And we have been mindful to refer to them as medical conditions and not chronic medical conditions. You will note that some of the conditions on the list would not be considered a chronic health condition.
Thank you for clarifying that. A second clarification, I have another question about that. Residents will book on vaccinate.dc.gov or the call center. These residents shouldn't reach out to their provider, say MedStar, who's a vaccine provider, because hospitals will continue to focus on healthcare workers and seniors. Is that right?
No, that
Okay.
is not correct.
Okay.
So as our eligibility expands to other phases, our healthcare providers will expand to additional phases. So our expectation is that those hospitals and health centers will expand to phase 1C at the same as this eligibility occurs on March 1st.
All right, thank you for clarifying that. And my last, has FEMA formally responded to the DC region's request to vaccinate specific frontline workers like mass transit and postal service?
Chris?
FEMA has not responded in writing, but we've been told that our request will not be approved.
Yes, Perry?
I have a question first for Dr. Nesbitt and then a few school budget questions. Initially, back in January, DC Health said you guys would vaccinate everyone on the 2 CDC list of conditions. Just looking at the list that you posted there, it seems that it's no longer overweight residents, but obese residents. The BMI seems to have gone up, and no longer smoking on the list. Were those removed, and if so, why?
So there's actually 3 lists that the CDC has. So we have a very science-driven approach to our work, as you may note if you've been following us very closely. And as Scientific Advisory Committee, when we met, we had one of our lead medical epidemiologists at DC Health review that data specifically and talk about what's called a type 2 error. That may be something that is overlooked, and I believe I've talked about it here in this forum as to why we were being very comprehensive initially. And so the list that the CDC publishes is based on what scientific evidence exists based on the type of studies that have been done today, or what's called a meta-analysis, the review of literature or review of data sets. So there are some where there is strong evidence, mixed evidence, or limited evidence available. And so we've looked at the combination of those three lists and in feedback from our Scientific Advisory Committee. So if I'm looking at it in the context of Amanda's question that asked if we would start at individuals who are 50 or older, individuals who have sickle cell, who have succumbed to this disease, their life expectancy isn't even 50. So we would miss the opportunity to provide them a vaccine that could protect them, reduce their risk for severe illness if we started with individuals who are 50 and older with a chronic health condition. So the same phenomenon occurs with individuals with HIV. We have on our Scientific Advisory Committee a pediatrician, a maternal fetal medicine provider, et cetera, who gives us guidance and advice, reviews literature, not just from the CDC, but World Health Organization, et cetera, that helps to inform this list. When we look at the data in terms of overweight, obesity, and smoking, in the communities that are disproportionately impacted in the district, it actually is such that obesity tends to be more prevalent than overweight in some of those communities, and so we believe we can still cover that population with obesity. And then smoking in those populations tends to be a behavior that is associated with these health conditions. So hopefully does that answer your question?
Yeah, so between January and now, has there been more data that's coming out on outcomes of these, overweight and smokers with COVID?
So if you also recall in January, in my discussion with you all, we had to talk about how we have to look at the data also in the context of vaccine supply and demand and potential for uptake. And so we're taking that into consideration as well. There are additional trade associations and organizations who have done additional data reviews and literature reviews. For example, I just got one recently, or reviewed something recently around the impact on individuals with intellectual and developmental disabilities, regardless of their living situation, right? So whether or not they're in congregate settings. And we've seen that same phenomenon play out in the District of Columbia. They are not explicitly listed on the CDC's list of chronic health conditions, right? And that's typically because they're not thought of as a population where intellectual and developmental disabilities is a chronic health condition. And so we wanted to be mindful, however, to still address that population when considering them to have a medical condition that would qualify them for vaccination as a priority.
Thank you.
Yes.
Can I have some budget?
Sure,
Chancellor Farabee. One, just on a pure kind of technical level, DC got $80 million, DCPS, I should say, got $80 million for federal care funding. How much of that, so summer learning would be fiscal year 2021. How much of this is part of the current budget cycle and how much of it is part of the next budget cycle when you talk about these acceleration academies and things like that?
Which ESSER funds are you referring to? So we had one stimulus that we received, and then we have indication of what the second stimulus amount will be. We have spent the first round on primarily technology and internet access for students, and then what you see here represented today includes the anticipated $80 million, which will be a part of the second round of stimulus.
Got it. And so for summer learning, any accelerated summer, is that part of fiscal year 2021 or 22 budgets?
So the stimulus would be a part of our summer and school year plan, so I wouldn't tie them necessarily to a particular fiscal year because we would need to ensure that schools have access to those dollars as soon as those funds are transferred over from OSSI to DCPS.
So this does not need to go through the typical council review process when you use these stimulus funds?
No, as soon as we receive those funds, we expect the schools to go to work with implementation of the acceleration plans.
And for the acceleration academies and high dose tutoring, is that in person or remote, or has that not been decided yet?
Yeah, so we will have a blend of options for students and families, which will include the ability to have some tutorials that would be remote based, and then we would have some of those services that would be in person. Ideally, the most optimal environment for acceleration and tutoring would be in person.
Would it be on the schools to decide that, or?
So we will have universal programming that will be available to all students that will be both in person and also remote available. And then at the school level, the schools will have guardrails in determining those options with the expectation that there be both in person and remote.
And the 25 to 30%, is that citywide or every school? I mean, we know that probably some schools have more than 25% that need this and some have fewer.
That is correct. You make a good point that the numbers that you see before you in terms of the anticipated population in each of the categories presented is based on school-wide data. That number could be dramatically different based on the school community population. So, for example, schools will receive more dollars if they have a higher percentage of students that fall into these categories or identified as at risk.
Thank you.
Yes, sir.
Hey, Mayor, I have 3 questions on 2 wildly different topics, but first off, I was just wondering if somebody could update us on how it's going keeping the roads clear today.
Sure.
And then in addition to that, just also what went into the thought process of closing testing for the virus today, but making sure you keep the vaccinations open.
Sure. So let me ask Chris to talk about the weather, and you can also address our approach to testing and vaccination location.
Thank you for the question. So I would say over a week ago, we had talked to the National Weather Service, anticipated about 10 days worth of on and off winter weather. And so DPW, as the lead agency for the snow team, and DDOT have been preparing for really almost a couple weeks now for this prolonged period of winter weather. And in terms of this particular event, their crews were out 24 hours prior to the arrival of the system, treating the roadways. We had anticipated that there'd be up to 6 inches of snow in the district. As with anything else, any weather event, sometimes it underperforms, sometimes it overperforms. This particular system brought a lot more freezing rain and sleet, as you can see outside, and see some of the roads. So there'll be some slushy conditions on the roads. They continue to be treated. There are DPW and DDOT plows out constantly treating particularly the major roadways in some of our residential areas. Over the next several hours, we should see the system slowly kind of depart, but there will still be some freezing rain and potentially refreeze as temperatures will not go above freezing until tomorrow late morning. And so we would just ask of our commuters to be careful if you're out on the roads and not to go out if you don't need to, except for essential activities. In terms of testing, I'll let Dr. Nesbitt talk about vaccinations, but in terms of testing, we made the decision last night, as we do in preparation for a lot of extreme weather that we see here in the district, particularly in the winter season. We do convene directors who brief out on how they're preparing for the weather and ultimately make recommendations up to the mayor. For testing, we knew that there'd be extreme conditions and wanted to make sure that we were keeping people safe. And also for some of the healthcare providers that are out there conducting the testing or assisting residents, make sure that they weren't out in those extreme conditions.
And as far as the keeping the vaccination going, was it just too important to cancel, or how?
Well, of course. And the other notable difference is that most of our publicly operated vaccination sites are outdoor or semi-outdoor versus the vaccination clinics are indoor operation. Most of them operate in locations that do not close during inclement weather. Our pharmacy locations, our grocery stores, our healthcare facilities, and so we're able to maintain those operations, work very closely with the Department of General Services to prioritize them for cleaning and making sure that they're salted and kept very safe to make for the staff and everything, which is a very different setup than our testing operations.
And my wildly different topic question, thank you both, appreciate it, was, Mayor, I'm told you're aware of this, but we're hearing that some folks, not sure how widespread it is, are not getting their direct deposit unemployment checks that they were supposed to get today. Are you aware of the issue, and can you, for people affected by it, just tell us what's going on?
Well, I am aware that we have a problem, or we had a problem yesterday or the day before that affected payments. I'm not aware how many people have been affected. And as soon as we've investigated and know what the fix is, we'll be able to report when those payments can be made. I understand that it affects 1 week. I'm not sure how many people didn't get the payment for that 1 week.
Is there anything you can say to kind of assure folks who are waiting for it and need the money, or is the city?
I can tell them we will investigate, get to the bottom of it, and get it fixed as soon as possible so that payment can be made. Okay, Mark?
Yeah, thank you. A couple of questions. One, the airports are now starting testing. Would that data come to DC at all, the test results? Do you know, I know the airports technically are not in DC, but will you get any of that data?
I think it's implied in the question that you're asking. We don't have any airports in the district. And so most test results go in the jurisdiction in which they have been completed. Most states have passed laws that require that, or regulations that require that test results be reported. Now, if a district resident is tested in another locality or jurisdiction and is found to be positive, then those jurisdictions have tend to done a really good job of communicating and working with us to pass that case and that positive case information on to us for follow-up and contact tracing.
And then in the list of workers or people who were qualified, we went from grocery store workers and social outreach, and then we went into the health conditions, but you skipped over postal workers. We're supposed to, according to the earlier list that were put out, postal workers were supposed to have come between grocery store workers and people with health, qualifying health conditions. So I'm just wondering if that is a result of the FEMA decision, or will you be, what happened to postal workers?
So we are optimistic that with some ongoing discussions with FEMA, that the request we have not yet received in writing can hopefully be different. The request we receive in writing can be different than the informal response that we received. So you'll note that the postal workers are included in the federal request.
So they're on pause until you get a definitive answer from FEMA?
Well, the chronic conditions folks are scheduled to go live on March 1st, and we're optimistic that we can continue to keep the dialogue and discussions going with FEMA and get a different decision about how we will approach federal workers with a supplemental supply of vaccine into the district for the federal workforce.
And then
And that would be for the region. It would
Correct.
be DC, Maryland, and Virginia. It's a regional request to FEMA.
Right. And then, do you know how many people are in these new groups, the grocery store workers, social workers, or the people with health conditions?
So the best estimates we have for any of those groups are the ones with the medical conditions, and that's because we have annual surveys that we conduct that help to estimate those populations, and it's estimated at around 160,000 individuals. We do note that some of those individuals are over the age of 65 and may have been previously vaccinated in other groups. They may also be individuals who are essential workers who were previously vaccinated as well.
And then my last on this round, can you update us on the variant data? The last time we spoke, you had confirmed 4 cases. Are there more cases? And then do you know anything more about the cases as far as who they are, if they traveled, what their condition is?
Sure. So we know that the individuals did not have a history of travel and that they have, by our last accounts, recovered. It is difficult, Mark, to quantify in the same way that we quantify the reported cases to you all, the number of variants. What we are able to do is, out of the 1% of cases that are sequenced, we're able to tell you if any of those cases are testing positive for variants. And we have not received notification that any additional cases that are being sequenced have tested positive for variants.
Were the people who were identified, were they notified?
That is not the national policy.
Thank you.
Okay, last round, Perry.
Yeah, a couple more budget-related questions. So, to the Chancellor, the council was frustrated that DCPS did not have a learning, they felt that DCPS did not have a learning loss plan last week. Does what you just announced today, is that DCPS's kind of acceleration and learning loss plan?
It's not kind of. I'm sorry, Chancellor. I just, first of all, it's absurd to suggest that the Chancellor of Schools is not concerned about accelerated learning after 1 year of children not being in school. So anyone who would suggest that is flatly wrong. the educators and all of us have been very focused on how we can address the needs of students, including getting them back in the classroom. So I want to just thank everyone involved in that. DCPS has been very focused. Our EOC has been very focused. Our teachers have been very focused at both pivoting to a virtual environment and getting back into the classroom. And the whole DC health apparatus has been focused on making sure that teachers and students and families have all the information that they need to make decisions for their families. So we're not going to address the suggestion that our public education team hasn't been focused on how to accelerate learning for children and all of us who have been impacted by a global pandemic. I think what you will see with this budget that we'll propose, starting today with the school-based budgets, starting with what the Chancellor has already said about the additional investments, including our proposals moving forward in 2022, is that we have no intention of on losing the gains that we've made for our kids and families and public education. So this is what you have before you. The Chancellor can go over some of the aspects of it again, but I want to make clear from our offices and working with DC Public Schools, but also working with DC Public Charter Schools, that we're going to do what's necessary to get our kids back on track.
Well said. I don't know if I have much to add to that because that's the sentiment of where I am. It was interesting when the responses were given about how we would approach high-dose tutoring, how we would approach academic acceleration, and then there was a question, well, what is the plan? And that is the plan. And I think we need to be really clear that there are no silver bullets to how we accelerate learning. There are no items you buy off the shelf and magically have our students back on track. It is going to require more time with our talented educators, with our students. And we've laid out a plan to make that happen. Now that will happen over a period of time. And not only do we need to be focused on the academic needs of our students, but you also see in our plan the social emotional needs for our students. And so that is embedded in the resources that schools have access to and can create plans accordingly.
Do you have any more details on staffing for this? I mean, do you anticipate, I know you talked a little bit about using some existing or qualified partners, but do you anticipate having to make any changes with the WT contract? I mean, will summer school be more extensive than we typically see?
Yeah, summer school would definitely be more than we anticipate. We anticipate serving more students. You ask about partners. We had a strong relationship last summer with Springboard, which was part of our literacy initiative to provide additional support for students. Our schools also have access to trusted partners that provide high-quality services. We can tap into those resources as well. But we know that our educators who know our students the best are oftentimes the strongest resources for these types of acceleration efforts, and we will rely on them as well as we look towards the summer and also beyond the summer.
Do you think any of these plans will require negotiations with the union?
Yeah, so it's interesting. President Davis has been talking about that, and from my vantage point, we have an MOA, and we're going to maintain what's in that MOA as we go forward. We'll continue to talk about what other challenges we need to solve for, but there is no interest at this time to create another MOA.
And how much of this, back to the very first technical question, how much of this relies on, the spending of this relies on what the per pupil spending will be? And when can we expect that number?
You can expect it when I present my budget to the council.
Okay, and is any of the funding from this contingent upon that, or we expect?
Well, all of our public education funding is kind of at the base of it is our per pupil funding. and changes to that. The chancellor has already laid out the mix of local and federal spending for the accelerated learning programs.
So some of these increases will be captured in whatever the budget that you present to the council. I know some of this comes from federal funds.
I'm not sure I follow your question.
I think that, meaning, I just want to know, I mean, so some of this will be taken from the per pupil funding, correct?
Per pupil funding supports all LEAs
Right.
at the base, so
Right.
yes.
Okay, so some of this will be contingent not only on the federal funding, but on our typical local spending.
Perhaps
Funding
the
process.
chancellor can better answer.
Yeah, so
Yeah.
I think you're asking, where does the local funding fit into these plans?
Yes.
It is a blended approach. So some of our summer programming, for example, is supported by our local funds, as we typically do each year. But that's a part of the fiscal '21 budget season. So fiscal '22 would then support next summer. So you'll see throughout these plans that there'll be a blend of the use of our local dollars, federal funding. For example, we talk about teacher investment in professional development. We have a RISE grant that will provide $9.3 million in this upcoming school year for our ability to support our one-star schools with additional professional development for teachers and performance incentives, retention incentives. And then we also have some local dollars that will be in the mix of that as well. So what schools will receive will be a blend of both our local funding, our federal dollars, and then the federal stimulus funds.
Okay, last questions. Amanda and then Mark.
Yeah, I appreciate the new vaccination dashboard. I wonder what metrics on this dashboard are you keeping a close eye on as a way to maybe measure success in our vaccinations? I ask because I know some residents have been looking at, say, like the Bloomberg tracker and have been fixating on their supplies used, which has us like below other states. And then some residents are focusing on this 2.5% of DC residents vaccinated. So I wonder what you're looking at.
I look at all of them. But it's also, I thank you for the question, Amanda, because it's very difficult for us to completely understand the methodology of all of these new trackers that are out there that compare states to one another. And it's my understanding that some of them pull from multiple sources without completely understanding the source data. So for example, you know that on our website, one of our charts, we focus a lot on first doses because first doses equal people who have initiated vaccination. When you look at total doses administered, you have to know the context of if those total, what the breakdown of those total doses is first doses and second doses, right? Total doses doesn't equal people. It's just the number of doses that are out there. And as more vaccines get approved, you'll have some vaccines that require 2 doses, some that require 1 dose, and it gets even more confusing. So we've been very much focused on the first doses as an indicator of the number of people for whom vaccination has been initiated. It's important for us to be able to communicate to folks who's partially vaccinated, meaning you've started the process, it'll be over for you in 21 days or 28 days, depending on the vaccine that you've gotten. And then people also want to know, are we getting toward herd immunity? Because there's this notion out there that once you have 70%, 80% of your population or the US population vaccinated, then we'll have herd immunity, and that means some sense of getting back to normal, or as we say in DC, getting better than normal, meeting our goals of health, opportunity, prosperity, and equity, right? The hope that we talked about in our reopening plan. That happens to be that 2.5% right now. We need to be moved, that's the number that's gonna match eventually to that 80%. So that's what we want folks to know. When we get the 1-dose vaccine, you know, the first dose will be the only dose for some people. So I have to look at all of it.
But I have to add, Dr. Nesbitt, having gotten my medical degree last night, that I think we don't only want those numbers for us, we want it for the whole region.
Correct.
We're so interconnected, as you can see, with workers and just how we do business in our region, how we live in our region, that it's not enough to have us be there and not have Maryland, Virginia, the close Maryland and Virginia suburbs be there. So I would kind of say more to your question that I want Dr. Nesbitt looking at ours, but I also want her looking at Prince George's, Montgomery, Fairfax, because those workers and people impact DC residents. So as it can be kind of frustrating, I think, to see us if we have a lower number of our DC residents, but when we have so many of our workers that serve DC residents in any number of ways that live in different places, you can see the impact that it has on us. So I would tell residents to look at our numbers, but also look at what's happening in the region, because that impacts our health, that impacts our hospitalizations and the function of our capacity in the city.
And one final question for you. Any idea who's going to replace outgoing CFO DeWitt? And are any that you're willing to share right now?
Well, we're just starting our process, and I don't have anything to say about that right now.
Okay, and then sorry, one last, are you concerned at all about how his leaving will affect the budget process?
I'm not.
Okay.
There's a great team at the Office of the Chief Financial Officer. We won't have a permanent chief during this budget process, but I will ensure that we have the right person serving in a interim capacity while we undergo a search.
Thank you.
Yes.
Yeah, just one for the doctor, one for you, Mayor. Dr. Nesbitt, pregnant women are on the list now. Can you talk about concerns that women who are pregnant might have and the reluctance that they might have to get a vaccine? Can you reassure them? What would your advice be?
Sure, thank you so much for the question. And we had a great discussion around the data that's out there right now for pregnant women and current recommendations on vaccination during pregnancy from the World Health Organization, Society of Maternal Fetal Medicine, and the American Congress on Obstetrics and Gynecology. And as I mentioned, we have a geneticist and maternal fetal medicine expert on our scientific advisory committee that helped walk us through the process. While pregnancy was not studied, or pregnant women were not included in initial clinical trials, we do now have the CDC with a database that has thousands of women who were pregnant because of the V-Safe program. And we participate in the Pregnancy Risk Assessment Monitoring System, or PRAMS, in the district that has added additional questions related to COVID-19 and vaccination. So there's more opportunities to collect more information about vaccination and pregnancy. For some women, the risk of COVID in pregnancy outweighs the perceived risk of vaccination during pregnancy with the ramping up of the immune system. So I would recommend that if you have an increased risk of exposure, or if you have an underlying health condition, that you really have that conversation with your healthcare provider to talk you through the best decision for you and your family around vaccination. So that's why we've been very permissive in terms of it as a medical condition for COVID-19 vaccination. If a woman would otherwise be offered vaccination because of her risk exposure or her health conditions, she should not, the vaccine should not be withheld from her just because she's pregnant. So I think that's critically important for people to know. But ultimately, it is her decision. Vaccination is voluntary, and we want women to be comfortable with the decision that they're making. But if you have that high risk of exposure, you have those underlying health conditions, which are very common in a lot of our women who are pregnant in DC, obesity, gestational diabetes, high blood pressure, I would highly recommend that they have those conversations with their healthcare provider and move forward with vaccination.
And then Mayor Bowser, just for you, have you had your second shot yet, and how did it go, if you did?
I did have my second shot. I had it on Tuesday, and it went fine. I didn't really feel any effects until about 24 hours later, where I felt kind of fatigued and tired. I took a nap, and then I felt better.
Thank you.
Thank you, everybody.